So I started treatment over a decade ago, and at that time the guidelines recommended you start treatment with a CD4 count of around 200. And so bearing in mind that my CD4 count was at that point at diagnosis, I really should have started treatment immediately on diagnosis. But my doctor worked with me to allow me some time to come to terms with my diagnosis, to learn about HIV and to learn about the treatments. So I spent 9 months kind of preparing my readiness, if you want to call it that, for starting therapy. So by the time I started, I felt ready and I wanted it. But I'd also started to feel a little bit unwell. My CD4 had held at 200, but the CD4 percentage had dropped down to 14%. And my doctor's words, I remember them distinctly. He said, "Robert, there's a truck round the corner that's waiting to knock you down. And I really think we need to get on with this now." And we were in agreement that it was the right thing to do. But you know, I'd spent that 9 months kind of really in a state of anxiety that was far worse than the reality of actually starting the pills. I can remember taking the first tablet in the lift at the hospital on my way out. I was that kind of keen to do it. And I waited for side effects, and some did come, but I was given a treatment at the time was the most commonly prescribed medication. And you know, and for many people, it's not unusual for their first combination not to perhaps be the best one that they're ever going to take. So I decided to speak with my doctor, kind of consult, get my bloods monitored, keep everything kind of well kind of taken care of, and I took my tablets. And over the course of a year, I made the decision to switch to something better.